Hello and welcome to SRG's Medicine. Today, in this topic of Respiratory Medicine Series, we shall be continuing our talks on abnormal breathing pattern. So, the contents of this video are gasping or agonal respiration, abnormalities due to position, vagal breathing and apneusis breathing, ataxic breathing, and ultimately, summary. So, let's start with gasping or agonal respiration. So, as we all know what gasping is. So, gasping is a maximal but brief inspiratory efforts which are separated by a long periods of expiration. But here, one thing to be noted is that, as we say in layman term, we call even a surprised breathing as gasping. That is not the case. Here, it represents a conditions or mechanism for gasping include the conditions which cause cerebral ischemia or extreme hypoxia or anoxia. So these are usually fatal conditions which cause gasping. And the causes can include cardiogenic shock, cardiac arrest, massive pulmonary edema, or drowning. And these are quite fatal conditions and need immediate medical attention. And the duration for gasping or agonal respiration can be as brief as 2 breaths and can last for up to several hours. So here we need to note that since these conditions are quite fatal condition and can progress to either complete apnea or death, hence these conditions require urgent medical attention. And talking about that, now we'll hear two of the audio clips, which will give us an overview of how gasping sounds like. So the first one goes like this. So that was the first audio. Now we'll move on to the next audio. Now here in the next audio, I've also included a graph which goes simultaneously with the audio. So please be sure to check on this. So here, as you can see, that there has been maximal but brief inspiratory efforts followed by a long period of expiration. So that is what we know as gasping. And we need to know that they need urgent medical attention. So talking about our next topic, that is the abnormality due to position. Here we have to first understand few basic things before moving on to the direct abnormalities. So the first thing that I'd like to tell here is that the amount of blood flowing to any organ or any part of the body is also affected indirectly by gravity, because when we are standing erect as shown here in the picture, there is increased amount of blood flow towards the lower part of the body, as in the legs or towards the lower part of the torso. So in such condition, there is decreased venous return to heart, and ultimately there is decreased workload on the heart. So when we are laying flat, then while laying flat or supine or laying still in the bed, in such condition, there is more flow of blood towards the lower back or back of the body, as we know as dorsum as well. So that is what the gravity causes in the body. Now here, when we're focusing specifically on thorax, then when we are standing erect or sitting straight, then in such condition, most of the blood will be pooled towards the lower part of the lungs. So any kind of abnormalities which are present in the lower part of the lungs are exacerbated by the sitting straight or standing. So in such conditions, we can see that these conditions are exacerbated, leading to breathlessness or dyspnea when we stand erect or sit. Whereas in any conditions that affect whole of the heart, whole of the lungs, and also some functions of the heart. So in such conditions, since there is increased amount of workload to the heart, as well as the conditions affecting the lungs are also being aggravated by laying flat, because the blood is distributed throughout the lungs. So in such conditions, we can see that there is aggravation of breathlessness while laying flat. So now we'll move on to the specific disorders. So the first one we'll be talking about here is platypnea. So in platypnea, as the name suggests, platy means flat and pnea means breathing. So the person is normally breathing while laying flat, or laying supine, whereas the person experiences dyspnea or any other kinds of breathing abnormalities while standing or sitting erect. Now, the conditions include, as we've already said, shuntings. So the shuntings include intracardiac shunting such as atrial septal defect, ventricular septal defect, or patent foraminovaly, and also extracardiac shunting such as pulmonary arteriovenous malformation. And other conditions also can be there, for example, hepatopulmonary syndrome, in which there is excessive pulmonary arteriovenous shunting. Now, why these conditions present with platypnea is that because in these conditions, previously also there is insufficiency of the amount of blood moving out to the heart. So when we are laying flat, then in such condition there is increased venous return to heart as compared to standing up. Then in such condition, when there is increased venous return, heart can pump effectively. So in the conditions of shunting, there's platypnea. Whereas talking about the other type of abnormalities, that is orthopnea. So as the name suggests, ortho means erect or straight, and pnea means breathing. So there is normal breathing when a person is sitting or standing erect, and there is dyspnea or any other kinds of breathing abnormalities while laying flat or supine. So the conditions for orthopnea include pulmonary edema, pneumonia, obesity, pleural effusion, ascites, or diaphragmatic weakness. So these conditions cause orthopnea. So now I'd like to mention about ascites, diaphragmatic weakness, and obesity. Now these conditions cause increased pressure on the abdominal contents or abdominal cavity, thereby pushing on the diaphragm, causing the inability of lungs to expand properly when the person is laying flat. So on such conditions, there is presence of dyspnea when the person lays flat. And when the person is standing up or sitting up, then these organs are pulled downwards due to gravity. So there is increased expansibility of lungs, hence causing orthopnea. So that was about platypnea and orthopnea. So now we'll be talking about next abnormalities, that is trepopnea. So what we mean by trepopnea is that the person can breathe normally while he or she is laying down on one side, whereas if the person lays on the other side, then in such condition, he or she experiences dyspnea. So the conditions for dyspnea can include any kind of unilateral pulmonary abnormalities. Here, the patients present such that the person can breathe normally if he or she is laying down with the normal or non-affected side downwards. Whereas in the cases of congestive cardiac failure, the person is normally breathing uh, without any kind of difficulties by sitting with right side downwards. Because when there is right side is towards the downside, or there is laying on the right side downwards, then in such condition, the venous return to heart is decreased, thereby decreasing the workload on the already congested or towards the failing heart. Hence, it causes relieving of the symptoms. Now, here is one exception, and it is that in the cases of one-sided pleural effusion, rather than being normal while on affected side downwards, the person feels normal when he or she keeps the affected side downwards. So normally in the cases of trepopnea with unilateral pulmonary abnormalities, the non-affected side downwards leads to normal non-dyspneic presentation. Whereas here in one-sided pleural effusion, the person can breathe normally when he or she keeps the effused lungs downwards. So that was about trepopnea. So now there's another abnormalities also, that is paroxysmal nocturnal dyspnea. Here, the patient wakes up all of a sudden in night, cups up severely, and then starts moving towards window or any kind of doors, or tries to move outdoors, searching for air. Or we can say here that the patient feels hunger of air and feels he or she is unable to breathe and wakes up suddenly at night. So that is the condition of paroxysmal nocturnal dyspnea. It can occur quite commonly in the cases of congestive cardiac failure and also in the other causes such as pulmonary hypertension or pulmonary congestion. So that was about paroxysmal nocturnal dyspnea. So now we'll be talking about vagal breathing. So vagal breathing is a slow and deep inspiration that is caused by the interruption of vagus nerve input to the brainstem. Here, these deep inspiration are interrupted by a brief period of expiration, and these are usually seen in animals and are not common in the cases of human. Whereas the other thing that will be talking is inspiratory apneusis. It is quite common in humans as compared to vagal breathing. And here we have to note that the presentation of vagal breathing and inspiratory apneusis are quite similar. Just the difference here is that the intensity of symptoms that we see in inspiratory apneusis is greater than that of vagal breathing. So even in inspiratory apneusis, we see that there is prolonged inspirations which are separated by brief expiration. And it is typically seen in the cases in which there is the lesions affecting the upper part of the bones, that is rostral bones, and along with the bilateral vagotomy or bilateral cutting effect on the vagus nerves. So now we'll see a graph representing the inspiratory apneusis. Here, in this graph, you can see that this line, as you can see with this mouse cursor, is the inspiratory phase. So there is a prolonged inspiratory phase, and it is interrupted in between by a short period of expiration. And this is what we know as inspiratory apneusis. And we have also talked in the previous video on the respiratory centers that apneustic breathing or apneusis was thought to be due to the action of apneustic centers. So that is what we see here. And now talking about the other type of symptom, that is ataxic breathing. So in ataxic breathing, it is the highly irregular respiration or inspirations which are often separated by a long periods of apnea. So in this ataxic breathing, the pattern of inspiration and expiration is quite irregular, and it is separated by a period of absence of breathing, so apnea. And it is seen mainly with medullary lesions. As we can say from the knowledge of the previous videos that medullary centers, or specifically the central pattern generator that is located in the pre-Botzinger's complex of ventral respiratory group in the medulla, is responsible for creating the respiratory pattern or normal respiratory patterns. So whenever there's lesions in the medulla, then it leads to the disruption of those normal respiratory pattern. Hence, the breathing becomes highly irregular, and they are separated by a long period of apnea, and this apnea is caused due to the feedback mechanisms on breathing. And ataxic breathing indicates poor prognosis, and as the breathing pattern progresses or deteriorates, then it merges with gasping, or as we also know as agonal breathing. So here is the graph of ataxic breathing. You can note here that this breathing pattern you can see over here is quite irregular as compared to the other kinds of breathing patterns which we have seen in the earlier videos as well. So now here we see that there's quite irregular breathing, and it is followed by a period of gap or apnea. Here there is no inspiration or expiration. So till this 1 minute time, there is ataxic or irregular breathing followed by a period of apnea. So that is what we know as ataxic breathing. So let's summarize this video. Gasping or agonal breathing is characterized by maximal inspiratory efforts followed by prolonged expiratory phase, which occurs due to hypoxia or cerebral ischemia in the cases of cardiac arrest. Platypnea, orthopnea, and trepopnea are the abnormalities of breathing due to the change in position, and they occur due to gravity. Vagal breathing and inspiratory apneusis are a pattern of prolonged inspiration, which are interrupted by brief periods of expiration and ultimately differ from each other in the cause as well as in the severity of the symptoms. And ataxic breathing are highly irregular breathing patterns, which are separated by a long periods of apnea, and it is generally seen in the cases of medullary lesions. So that was about the summary of this video. Hope you enjoyed it. Thank you. Please Please stay tuned and be sure to subscribe for the upcoming videos. Hope you enjoyed it. Thank you.